For many young people, this is how a first psychotic episode begins. This is schizophrenia. Schizophrenia is a serious mental disorder that affects how a person thinks, feels, and behaves. It is not about having split personalities. It is about losing the clear boundary between what is real and what is not. People with schizophrenia may experience hallucinations, such as hearing voices or seeing things that aren't there. They may also have delusions, strong beliefs that are not based in reality, such as believing others are spying on them or controlling their thoughts. It often begins in late adolescence or early adulthood, the same age as many of us right now. Let's look at a real life example. A Nobel Prize winning mathematician, John Nash, publicly lived with paranoid schizophrenia. He believed secret agencies were watching him and sending him coded messages. He heard voices that no one else could hear and became trapped in frightening delusions. After treatment and strong social support, his condition improved and he continued his career. His life story was later portrayed in the film A Beautiful Mind. Another case reported in psychiatric literature involved a 20-year-old university student. He began withdrawing from friends and missing lectures. He heard a male voice commenting on everything he did, and he believed that his classmate was secretly recording him and the television was sending him coded messages. During exam week, the voices became overwhelming, and he was brought to the hospital after panicking in his dorm. With antipsychotic medication, psychotherapy, and family support, his symptoms reduced and he returned to study with follow-up care. This example shows an important truth. Recovery is possible. A first psychotic episode is frightening for the person and for those around them. Families and friends should know that schizophrenia is not a character flaw, it's not laziness, and not a weakness. It is a medical condition. During an episode, avoid arguing with the delusion or shouting at the person. Speak calmly, reduce stimulation, make sure they are physically safe, and most importantly, seek professional help immediately, as early treatment improves outcomes. Some common warning signs include hearing voices or seeing things others don't, strong unusual beliefs or paranoia, talking in a confused or disorganized way, social withdrawal and loss of motivation, decline in academic or work performance, and neglect of hygiene or self-care. Experiencing any one of these symptoms alone doesn't mean schizophrenia, but it changes in several areas over time that deserves attention. People with schizophrenia are not crazy. They are human beings experiencing a medical condition involving the brain. Stigma is often more painful than the disorder itself. Here's what we can do. Stop using words like crazy as a joke. Encourage early help rather than blaming. Listening without arguing with their experiences. And support treatment instead of shame. With the right support, many individuals with schizophrenia can study, work, and live meaningful lives. If you or someone you know is hearing voices, seeing things others don't, or losing touch with reality, seek professional help early. Early treatment saves lives and improves recovery. Schizophrenia is not a weakness. It's an illness, and treatment works. Let's replace stigma with understanding, fear with knowledge, and silence with support.